And then wait a couple minutes until people get situated. All right. Good evening, everyone. My name is Allison Foss, and I am the Executive Director of the Myasthenia Gravis Association. We are so grateful that you have joined us this evening. If this is your first time joining us, welcome. If you are newly diagnosed with myasthenia gravis and you need a new patient packet, please visit our website, www.mgakc.org, and we'll be glad to get you one. Following tonight's presentation, we will also have a survey that we'll be sending out through email. And in that survey, we'll list upcoming virtual webinars that you may be interested in. So we hope that you'll join us again. I also want to give a quick introduction to Catherine Clemens and McKenna Fulton. They are team members at the MGA. They have joined us this evening for our presentation. So again, thank you for joining us. I am excited to introduce you to Dr. Ghazala Hayat. Dr. Hayat is at St. Louis University, and she, together with Dr. Hayat, we have an MG clinic that Catherine works in on Tuesdays. So if you're a patient there, you probably have seen Catherine in the clinic with Dr. Hayat. So Dr. Hayat, I'll go ahead and turn it over to you to share about MG and exercise.
Hi, good afternoon. Thank you very much for joining. It's my pleasure to join you this afternoon, and it's a very important topic that I'll be discussing. So when Allison contacted me, I thought it was very good topic, very timely topic, because this question keeps coming up. Okay, so I do not have any relevant financial disclosures, and I will not be discussing any FDA off-label indications. So what are objectives of my next, so what my plan is that I'm going to talk for about maybe 40-45 minutes, and then open up for questions. I think you can place it in chat, and they will be taking the questions, and later on we can go over all the questions. If I don't know the answer, I'll get it for you. So I'm just going to talk briefly about what are the causes of weakness in myasthenia gravis. If you're a patient or caregiver, you have seen that most of the time you feel much better in the morning or when you're not tired, but towards the end of the day, the weakness gets worse. And we try to be more careful. So the question when it comes up that should we do exercise or not, that is a difficult question to answer at that time. Second is, what are the different types of exercises, right? The patient will ask, oh, can I swim? Can I do this? Can I do that? And I'm going to go very briefly, hopefully in a simple term, what kind of exercise are there. Most of you are know about these exercises. We hear about that all the times. You know, it's like do exercise, eat right, sleep, all those things. And they still hold true for our myasthenia gravis patients too. And what are the risk of benefits and what are the benefits and risk of exercise in myasthenia gravis? So if most of you might be aware of this, or if your doctor has discussed with you, so basically we talk about this neuromuscular junction. This is so I've at the bottom, I've put my references where I took those pictures from. So in myasthenia gravis, it's just like a cartoon. This is the nerve ending where we have this blue, if you think these are called acetylcholine quanta. It's like, just think about a reserve in there. And this is the muscle where we have on top of those, just like Y type of thing, those are the receptors. So whenever it's the, like right now, if I'm moving my mouse, the message is going to my finger. It's just going to go through that. And this nerve will then start releasing these acetylcholine quanta, which is going to release, which is the acetylcholine, and it goes and connects to the acetylcholine receptor, which look like Y there. that's why when we are diagnosing myasthenia gravis, we always say it's acetylcholine receptor antibodies, because those are the most common, but not the only one. Some patient might have MuSK, and very few also may have LRP4. And there's some of you might be just what we call seronegative. It does not mean the antibodies are not there. It just simply means we have not identified, or the assays we have cannot pick it up. So this happens. It goes, makes connection with these receptors, and then the muscle contracts. It gets the message, muscle contracts. Now, let's say if I have to do repeated exercises, let's say if you ask me to pick up 10 pounds weight and just go from one hallway one end to the another one, and I keep on doing it, I can do it. Most of people, depending upon their endurance and, strength, they will be able to go back and forth back. Eventually I'll get tired and I'll start getting slower and slower. Time might come if they don't stop me, that I say I cannot do it. This kind of theory is, just think about it, these quantas which we have is, if we just need to do simple activity during the day, what will happen is that I can catch up with that, no problem. We have what we call a reserve quanta, if you want to think about it. So if you ask me to just, or maybe say, ask me 50 pounds of weight, pick up and put it in another closet, and pick up and put it. These other ones which are higher in the reserve, they come down, because now I need much more, which causes contraction. I can keep it, the muscle active. And we also have kind of safety factor that might make you understand what happens, why we get weaker as the day goes on, or as the patient gets tired. The safety factor keeps us, so you can do lots of activities without having any weakness or symptoms of myasthenia gravis, right? If you get up, if you're not on any treatment for a few hours during the day, might be fine. Towards the end, when all these you're getting, because there are fewer receptors left in myasthenia gravis, when the quantas are released, they have only very few. Just think about receptor where to go and connect. When they can't connect, the muscle doesn't contract. And eventually what happens is they keep on coming, and they're very few, and they don't connect, and patients start getting weaker. You rest, these quanta also then come back, and they can make new connection, and the patient contracts, and you feel better. So this is the kind of usually basis for myasthenia gravis, what's happening. It causes weakness. Most of the times, it's what we call proximal, and it starts from the, most commonly it's eye muscles. And most of the patient will start, we say 60, depending on the study, say 60 to 80% of the patient will start with eye muscle. You may have droopy eyelid, might be seeing double, and then depending upon the studies, at the most, just think about it, in 1 year, patients can become generalized. And this question keeps on coming, or should I do exercise, or I'm going to get weaker? So depending upon this, another thing I'm going to discuss in the, I think, next slide is fatigue. And we have this kind of some evidence of the way patient present. It's not only muscle weakness. If I'm weak because my muscles are not functioning due to myasthenia, I will be tired, but if those, like, let's say if I rest, it should improve, but the fatigue the patient might not improve to that extent, and we'll go over that, what we think may be causing it. So here is, which is a patient who has myasthenia gravis, which I was talking about. And this is just, I'm going to bring it up. And usually if it's a long-standing without treatment, if you can see, there are lots of receptors on, if you're looking at the slide on your left side, or those Y-shaped. But if on the right side, with the patient who has myasthenia gravis, there are very, very few left, because these antibodies will go, the kind of complex they make, they can destroy it. The longer the process goes on, the longer it's not being treated. This cleft, or the distance between the nerve and the muscle, starts getting bigger and bigger, and these receptors become fewer and fewer. And sometimes what we call internalized is just going to go inside the muscle, and then those kind of patients will develop permanent weakness, and can. And I would say I'm glad that I don't see those kind of patients. I haven't seen in a long time. I have few patients in my practice, which were like before, long time ago, they did not take medicine or did not follow up or were not treated appropriately, and they have developed permanent weakness. So when we're talking about exercise in different patients, just keep in mind how we treat those patients. Okay. So one thing, excuse me, if you go to your doctor, we check what we call MG-ADL, or activity of daily life, and myasthenia gravis. So we ask you a lot of questions. And then there's another survey we ask about what we call quality of life. Excuse me. So what, it's known factor that even if patients' ADL score, excuse me, ADL score, which is, we say if you have a droopy eyelid, you have difficulty swallowing, you have double vision, you have difficulty brushing your teeth, all those things might be better, but quality of life may not be that good. So there we always, in our clinic, we check both of those, because if your quality of life is not good, even if your muscle strength or that is stable, it's still affecting your life. So we need to keep in mind and see how we can improve. And it's also limited mobility, which I talked about. Maybe just your worsening of myasthenia towards the end of the day, or the condition itself. And also all this can lead to reactive depression too. And as we know, this is an immune-mediated disorder. So we know that as a rule, most of the immune disorders are seen in females, and neurodegenerative disorders like Alzheimer and, let's say, Lou Gehrig disease, Parkinson, we see a little bit more in males. It's not that the other gender cannot get it, but a little bit. And most commonly, we see myasthenia gravis, we see young females. It's an immune-mediated disorder. And so fatigue, which I was talking about, one is the weakness, another one is fatigue. Now, the question is, do we have a central fatigue that this process may be not even related to our muscle weakness? If I'm getting weaker due to myasthenia towards the end of the day that I cannot climb up steps, I rest and it should improve, but it's still not improved. My muscle strength, if you went to, if the doctor tested and I say, oh, that's totally normal, but patient will say, I'm tired, I'm diffusely tired, and they cannot say, I'm tired in my arms or legs, they just feel I'm tired all over. So it may be some central fatigue. Another thing is we need to remember all the neuromuscular disorders, or almost all of them, do lead to fatigue. I mean, we don't know in detail or in depth why it causes it, but this is known fact. Different neuromuscular disorders will cause patients to feel or experience fatigue. So what it does is, if you're tired, it's going to discourage you, myasthenia gravis patients, for doing exercise, right? If I'm tired, I'm fatigued, that's the last thing I'll be thinking about, that I want to do exercise. So one misconception is, oh, I have myasthenia, if I'm going to do more activity, I'm going to get weaker. Second thing is, if you have this fatigue, you might be more discouraged or might not be encouraged to get up and do exercise. So this fatigue, which I discussed, is a little bit different from what we do on testing, which I discuss about that neuromuscular junction, that if, let's say you ask a patient with myasthenia, pick up this 50 pounds bag of sugar, and they're like 10 bags, and go back and forth. And it's possible, depending on how severe the disease is, after fourth or fifth bag, they say, I cannot do it. Depending upon if it's severe, after first or second bag, they say, cannot do it. And to prove that the patient has myasthenia, we do this, what we call repetitive nerve stimulation. And most of you might have seen it. It's just, I'm just going to show, it's briefly, it's like when we give it's an electrical stimulus, it will cause this action potential. So remember where I showed you, goes, those blue dots, the acetylcholine will make connection with those Y-shaped receptors and cause muscle to contract. This is what we're recording. And what will happen is that a normal person, even if we keep on doing one after the another, remember I said we have a safety factor, there should not be much decrement or decrease. It should be almost like we're one after the another. It should not drop more than 11%. And then we ask you to exercise. If you do exercise soon after, that's what I wanted to bring to your attention. You see, the lower amplitude actually got better. And what it's doing is because when we do exercise, or our neurons, our nerve cells know that there's much more demand, those reserve quanta will come into picture too. They will be also dumped, and will cause us to feel a little bit, more strength or higher amplitude. And then after 1 minute of post-exercise, 2 minutes, if patients are not on treatment, anything, you will start seeing that they're getting even lower than the first one, which is A. Look at the E. It will be just like 4 minutes after exercise. It will be much lower. Patient gets weaker. That's what the normal presentation of patient with myasthenia is. Now, another thing is very important is that the patients who have myasthenia doesn't mean that they cannot have high blood pressure, doesn't mean, and sometimes before we had the neurobiologic, patients were primarily on prednisone and one of the few immune modulating drugs like azathioprine or mycophenolate or cyclosporin, and any of those we're putting in. But patients, so they could be diabetic, patient could have stomach disease, patient could have urogenital, which is like urinary and the genital type of disorders, other musculoskeletal disorders, heart diseases. And so this one, they looked at this study, Alexiva, and it was published in Neurology in 2019. So I just want to show it to you. So patient could be this is like autoimmune comorbidities. So you could have, I'm sure you know that with myasthenia, patients are known to have or have more propensity of other immune-mediated disorders. So like thyroid is very common. You could have other vasculitis-related disorders like lupus and any one of those. So this one they looked at is kind of, I just want to clarify how it is. So if you're taking steroids, you might have associated autoimmune comorbidities, or you might not, or this is no steroids with those, without those. So you can see, look at this. Metabolic disease are basically, we talk about diabetes and those high lipids or cholesterol. So you can see it that the patients will have those disorders. They have cerebrovascular disease, which is like stroke or other kind of related. Urogenital, we discussed about muscle diseases, heart diseases, stomach, the gastrointestinal diseases. So when we go over that, actually this study showed that these patients, when they were, and these are patients who had myasthenia plus this, when they were in exercise program, they did better. And I will go over that, but the recommendation is still, it maybe looks very hard, even for a person without any medical issues. You ask them to do exercise 30 minutes a day for 5 days per week or 150 minutes. Most of the people don't stick to that. Or it's a little bit harder, but we'll go over that. And once you start doing it, it becomes much easier to continue doing that. I'm sorry, did I even go back? Let me see. Okay, yeah, so let's go. So what does physical inactivity do? It's the same as for patients with any other medical disorder, which I put the list, and many more, and also even if you don't have medical disorders, okay? So what will happen is physical inactivity. If we don't do anything, we're going to produce less oxygen. That's a known fact. So skin, we always say, oh, patients, and you will comment to other people, your skin looks very good at this, and they might be just exercising. There's not enough of those expensive cosmetics. Lack of nutrition lead to unhealthy skin and hair, exhaustion, headaches, low moods, and difficulties in concentrating. It's a known fact. The older we get, the less we move, the higher incidence of our bones becoming thinner, getting arthritis, stiffness, difficulty moving, and then we get into this vicious cycle. We don't move, we get stiff, and then we have harder time getting up and moving because it's hurting now, which is another impediment. We say, okay, I'm not going to move because I'm having pain. Although, if we continue doing it, you will improve. Heart muscle grow weak if we do not do exercise and strain to do basic activity. Now it's been proven that the stomach and the brain is like there's a kind of a connection. You might have heard about these all nice bacteria in the body and all those things, the stomach and those intestines. So simple as can cause constipation. But if you do exercise, the brain, I mean, those like endorphin we talked about, which makes us feel better, and also stomach and the gut and those microbes, they do better. Bones, I discussed with that. If we don't move, they become weaker. And so, like, also, they say kidney function gets better. So this is physical inactivity for any person. Myasthenia gravis related fatigue hindering exercise. Exercise capacity may be decreased because of that fatigue. Impairment in respiratory muscle if patient is not being treated, or even if it's myasthenia is moderate or severe. So that's what leads to, which I discussed before, what happens. We just do less exercise due to myasthenia gravis. And then it can lead to being overweight, and then I talked about getting into that vicious cycle. Okay. I like this picture, all of us have kids, or we have worked with kids, and most important thing is ask your doctor. It's the power of communication. It's not simple or not smart question. Ask the doctor. I want to do, is exercise good for me? I want to do exercise. What should I do? What are my limitations? And how I can improve it. But I looked at this child's face, we tell them do something good, and they kind of, which they don't like, make the faces. Okay, so I'm going to go briefly over the types of exercises. Well, I'm going to brief in the next few slides, I'm going to go over that, what those include. So we have resistance exercises, aerobic exercise, almost all of everybody knows, just run, the jumping, all those things. Respiratory, build up your lungs and the lung muscles, that's good one. And the rehabilitative, if patients have weakness or like because I need a surgery or other, they need to go through intense rehabilitation. So resistance exercises are basically where against something, what we call two joints, everything, they're fixed or kind of thing. So squats, lunges, these resistance bands are very good, especially patients who feel like they don't have enough balance. They can use it, hold onto the chair or something, and then try to move their legs like this, side to side, bilaterally, arms. You can find any one of those online. Push-ups, these are, and then sit-ups. So those are the good. So basically, it's a squat, benching, press, weightlifting. So basically, we do weightlifting. What it will do, musculoskeletal health will improve. It will decrease the chances of patient having thinner bones, arthritis, because the more we move the joints, there's kind of just think about, there's a fluid inside the joints. It will improve that joint health. It becomes a bit more lubricated. So you can do push-up, swimming, cycling, dance, and aerobics. Any one of those you could do. And then aerobic exercises, actually where you do it, but riding a bike, jumping, running, swimming, how fast and how much you do it, that can become aerobic exercises. Hiking, all those things are basically aerobic exercises. And the respiratory exercises decrease the work of breathing, increase your efficiencies of your lung. So yoga and all those kind of exercises can help you. You're taking deep breath in, holding it, and then slowly exhaling. It makes what it does. The lungs itself is not affected by myasthenia gravis, but our muscles, which are our chest, they can get weaker. So if we do these exercises, it's going to improve those. And what it does, it improves our endurance. So if before I could take maybe 2 bags of 50 pounds, if I improve my endurance through exercise, I might be able to do 4. So why is exercise good for myasthenia gravis patient? Besides everybody we talked, every patient, every person should do exercise. As I mentioned, myasthenia is an immune-mediated disorder, and it's been proven, multiple studies have shown what it does. This is on the right-hand side. Basically, what it is doing is reducing the stress levels, it's increasing energy level, reducing depression, increase mood, reduce anxiety, and all those things, effects on those level. And it's been shown that it improves your neurocognitive, like your memory and all those things. It's like the same kind of theory that we talk about, that if you do crossword puzzle or any of those, the connection in the brain of the brain cells improve, or those connections are better. It's like, don't use it, lose it type of thing. Keep everything active, that will help. It improves your mobility, and for sure, then it will increase those quality of life, which I discussed before. So this what it does to exercise on the immune system. Immune response with rise in T regulatory cells. It's just a little bit technical term, but basically just think about our regulatory cells is actually help us to control the, immune process. It decreases Th1 cells, which helps with the decreasing inflammatory response. Whenever we have immune response, remember I showed you the neuromuscular junction, that cartoon, and which I said that you have fewer and fewer receptors, and it can become the cleft, or the distance between cell and the muscles can become bigger. Those are inflammatory things. They're just kind of killing it. It will help to improve that process in the positive direction. And then also decrease immunoglobulins. When we give plasma exchange, when we give any one of the Fc receptors inhibitor, that's what we're trying to do it, that we're trying to decrease immunoglobulins, which can continue with the immune process. We're decreasing those, so increasing the patient's immune response and less damage to the immune response. Okay, so this is a study which was just in 2020. So what the study showed, that it's beneficial for, for physical and psychiatric disorders. They went over that. And then it has effects on the symptom and also outcome of a patient. That's what we're looking in. Persistent exercises are the key. I just bring it up to all of my colleagues and my patient. It's Al Roker in one of the TV. He said something, and I think it should be written in golden words. Anytime I remember, I say, so true. He was overweight, and then he went through the procedure a long time ago, but then he kept it off. And usually patients even after going after procedure may gain function, the weights again. And what happened is somebody asked him, I think years later, that you have kept it off. What is the secret? And he said, because I do not give up exercise. And he brought this point up, which is so true. He said, just think about it. Any day, if we have to give up something, anything comes up or any excuse, the first thing we say, I'm not going to do exercise today. I'm busy. I have to write this paper. I have to do this, or friends are here, or this. He said, we never say, I'm not going to eat today because I'm busy. So this should be taken as seriously as our food, everything, because that is the key. So this study on the right-hand side, where I put it Lohi, what they did, although there was some kind of, I would say, comments, or there were a question about the study, what they did on one side, they used it as a control. These are patients with mild and moderate myasthenia gravis. And the other side, they did resistance exercises and movements and everything. And they showed muscle force increased 23% on the side, which they were doing the exercises, and compared to 4% on the control side, which you could say placebo or no exercise was done on that side. So one thing they have seen, and other couple of studies also, that there may be some temporary worsening of fatigue in other studies, but the best thing is if you, which I say persistent, if you continue doing it, the fatigue will also improve. Remember I talked about neurocognitive, it decreases the stress, everything. So all those combined, because depression is common, which could be reactive or anything in myasthenia. If we're taking care of those, improving your mood, everything, that will help with this fatigue also and help you to continue doing exercises. And there's another study, Westerberg. He actually, on a patient who had myasthenia gravis, did exercise. They did ultrasound before and after, and they showed the thickness of muscle had increased, which is a sign, which is like, people talk about, I'm building up my muscle. These are studies. I do not want to bore you with all those things, but I'm just going to give you a little bit what was done. So this one is a 36-year-old. This is the author, marathon running, trained 5 to 10 kilometer weekly runs. We can think about it during the first 2 years after myasthenia gravis onset. Patient stable. She still had right-handed weakness, occasional ocular and bulbar symptoms at the end of her periodostigmine dose. Patient was able to discontinue azathioprine because she was improving. Normal respiratory function, and stable limb strength in knee flexion and extensor. This is another report where the ultra marathon in a hot environment, 35-degree ambient temperature, completed 220-kilometer ultra marathon, his fifth one. He had fluctuating leg weakness, some dysphagia, and dyspnea during the race, which subsided with rest or periodostigmine. There's another 26-year-old, 15-week resistance training program, bench presses, leg curls, and creatinine supplementation. There's not any other data which tell you it will help. In the muscle disease, we have noticed if you give creatinine, it might help patients with that. It showed increased body weight, increased fat-free mass, which is the healthier one, increased peak strength for leg extension and leg flexion. And this is a 17-year-old patient with generalized myasthenia gravis, college football player, continued to train football while experiencing mild leftosis and mild decrease in tolerance to increased exercise. He retired from football, not because of weakness, but he had a back injury, continued to play recreational sports. So you can look at this. These are, which are like patients without any medical history, are also difficult, but patient with myasthenia gravis did very well. Okay. Now, another thing is this, I just put there because the studies, the articles that I've mentioned, there's also evidence for any kind of procedure. Patients who have myasthenia gravis, if they're going to have procedure, if those patients had exercises, they did exercises, training, and were very active before, a few weeks before and after the surgery, their post-operative period was much shorter. If they were intubated or extubated, they can get extubated faster, and their discharges earlier. And thymoma is seen in only about 15% of the patient, mostly in myasthenia gravis patient over 30 years of age. And this is, we do this CT scan. This is showing the thymoma. So, and it's basically, this just from your myasthenia gravis. Now we have a study which shows double-blind that patients, even if they don't have thymoma, thymectomy helps them. So exercise before and after the surgery decreased morbidity, hospital stay. So there were 2 days, they were gone home 2 days earlier than the patient who did not do exercise. Okay, so what are my conclusions are the regular exercise is beneficial and safe for mild to moderate myasthenia gravis. Mixed resistance and aerobic exercise, you should do it. That will help a lot. Spend about 150 minutes per week. Okay. And before and after surgical procedure can lessen the time to recovery. So if you are not doing exercises currently, do not start at 30 minutes a day, okay? You have to build your endurance. If you have any severe arthritis, anything, make sure that's taken care of. Discuss with your primary care physician what needs to be done about those conditions, and if they allow you to do exercises. You can start with simple, what we call warm up, and start doing. If you want to start, anything is better than nothing. You want to start 15 minutes a day, and then slowly and gradually, once you start building up your endurance, you should be able to bring it up to 15 to go to from 10, 15 to go to 20, then 2-3 weeks later, see if you can go to 20, 25. Now, if you feel like after you're doing 20 minutes and you're getting more fatigued or much more tired, then come back to 15 and see how long you can do it. And your aim should be that I'll try to increase it. But don't get discouraged if you cannot do 150 minutes of those. You can do your stationary bike. You can, if nothing else, just walk. I mean, in St. Louis, currently is such a bad weather, but I mean, if it's a good weather, going out is going to with fresh air, especially we always say the morning walks are probably the best. It's a fresh air, be good for the lungs and everything. If you have to do at home, you have a treadmill, slower speed, without incline, do as much as you can, okay? But be persistent, because if we continue doing it, it will have effect on the immune system, which will have definitely beneficial effect on the condition of myasthenia gravis. As I mentioned, we have this theory about a central fatigue. If we do exercise, because it's shown, if you have done exercise, you feel better. Before, the idea was, oh, people are happy because they achieved something, they did something. But the studies have shown that endorphin, which is like a good type of, these are released into the body, and that makes you feel good, decreases your stress, decreases your anxiety, depression, which always have a positive effect on the health. And in myasthenia gravis, as much as you can help yourself from that perspective, it's going to improve quality of life. So you will have just like you're going to get positive effect from both sides. If you have other comorbidities, like we discussed about diabetes or heart disease or stroke, any of those, discuss with your neurologist, your primary care physician, what's safest for you. Do not start with very heavy weights. If you're going to start doing weights, start low. See if you can 5 to 10 pounds. If you have no issue with that, you can slowly increase the weights. Not everybody can afford or have time to go to gym and have a trainer, but you can do most of the things without any cost at home or just outside walking. So thank you very much for your attention. I gave you about 20 minutes. Any questions, comments, I'll be happy to answer those.
Thank you so much, Dr. Hayat. It looks like we've got questions in the Q&A. Do you want me to read them to you, or do you want to look at them?
Yeah, you can read it to me, so that will make it much go smoother.
Sure. So the first one is, what types of exercise should a person with MG who has steroid-induced osteoporosis avoid to prevent bone fractures?
Okay, so this is usually, it will be if you start doing more resistance exercises. That is can cause, because remember I told you there are 2 joints. So you should not avoid it. You should do it the minimal, but walking, swimming, I always say water aerobics are for those patients are the best. You get into the pool and just do those exercises in the water, because then you will not have any weights on your joints. So that will be the best thing. But those kind of lifting heavy weights, squatting, and all those things probably will be less safer for those patients.
Okay. And question in the chat, where does walking fit into the exercise program?
So that's something, I mean, to start, if walking is basically, your leisurely walking is still good, but it's not going to give you all those benefits, which I talked about, improving your respiratory function, your heart muscle, and all those things. If you want to do walking, it should be brisk walk. It should be really brisk walk that you could, walk so much. I mean, we always talk about, 10,000 steps a day and all those things. Those are good. I mean, those what we need, but I think most of the times, if you want some really beneficial effect from walking, it should be brisk walk. But I'm not discouraging you. If you can just even leisurely walk, that's better than doing nothing, because that will keep your joints moving and less spasticity and tightness.
Thank you. Next question. How do we know the difference between MG muscle tiredness and just tiredness from working out?
Oh, that's a good point. That is usually, myasthenia gravis muscle weakness is usually what we call proximal. That's what I talked about. So whatever the patient's symptoms are, those will be getting worse. If patient gets droopy eyelid, you might be getting, because of that, you might start having more droopy eyelid, might start seeing double, or you might start having difficulty speaking, or raising your arms above the head. If the other tiredness is just like, I always say you feel like your muscles feel like jello, it's just like diffuse weakness all over. It's less than weakness. It's like feeling that I'm tired, or the whole body will be tired.
Okay. Is there anything we can do to normalize the muscles in our digestive tract that are adversely affected by prednisone and mestinon?
Okay, so the mestinon, basically, most of the time, is just those are the side effects, okay? It does not cause any damage to the wall, if that's the question, correct? If I understand correctly, right? Because they're saying those damage done by prednisone and pyridostigmine.
Adversely affected by prednisone and
Yeah,
mestinon.
okay, yeah. So only thing, let's start with the pyridostigmine. I'll talk about the prednisone. Pyridostigmine actually doesn't cause it. It's just a side effect. You get stomach cramps, diarrhea, tearing of eyes. You stop taking it, it should go away. I always say it's just like taking Tylenol. It makes your fever go down, but that's about it. You take it, your myasthenia symptoms are better for a little while, but then it'll come back, but it has side effects. Some patients don't have any side effects related to that. Most of the other patients will have some degree of side effects. Prednisone actually causes your covering or mucosa of the stomach can get damaged because of that. That's why if you're taking prednisone, it's very important that you take something like, Prilosec, anything. It's better if your physician prescribes it, but you can take over the counter. Make sure you take it till you are on prednisone, because it can do damage to that, can cause ulcer. Those are the main, but also because of prednisone can also cause, high blood pressure, other related metabolic disorder, then that needs to be treated separately. But that's the main damage done by prednisone to the stomach, is the ulcers and those activities.
Okay. How long does it take to develop permanent weakness, and what can I do to prevent this?
But the permanent weakness, if you're seeing a doctor being treated, more than likely you will not develop it. I do not promise any patients. The thing is, if you remember that cartoon which I showed you, where it was the normal junction on the left side and the abnormal on the right side, those few Y or those receptors left, then they become, just think about, engulfed by that muscle or what we call, and there's nothing left because that inflammatory process has killed that. If you take treatment, besides pyridostigmine does not do anything to that process. It should slow it down. We're always hoping that we stop it. But even if it slows it down, that's your best effort, is take your medication, follow with your physician, because they will keep an eye. if the process your exam, if they have to add new medications or they have to change the medicine. And as I mentioned, keep exercise as part of your routine as much as you can.
Thank you. The next question is, what vitamins support working out with MG?
What vitamins to take before working out?
It just says, what vitamins support working out with MG?
Oh, I see. Okay. So let me make it very clear. If you're not deficient in vitamins, you do not need to take vitamins. It's as simple as that. If you're not a good, or what should I say, healthy eater, talk with your physician and he or she can check your vitamin levels, and whichever is weak, we can take it. Most of the time, it just goes out, and then it just, if I don't need it, we're just wasting it. But their vitamin B6, a lot of these vitamins in supplement have different vitamins, and vitamin B6, if you take more than what you need, you might have tingling, numbness. So you do not need to do vitamins. Or another thing is, during COVID and everything, we were saying that a lot of these infectious disease people that take some zinc, that might help. I think that has also, a lot of people are taking zinc without any reason, and that can cause sometimes changes in the body, which is kind of like a risk. So if you do not need it, if you're a good, healthy eater, you should not need any vitamins.
All right. Before MG, I would do an exercise to the point of pain. Should I press that hard with MG?
Before MG, I used to exercise till I got pain.
Mm-hmm.
Okay. No, so I think, remember I mentioned that if you're getting, if your fatigue, a couple of studies they showed that might be fatigue might get worse. If you're getting that, that means you reach your limit. Or if your myasthenia symptoms are getting worse, you're reaching your limit. You should not hurt, if you were doing before it, reaching to the pain level, I don't think you should do it for myasthenia. You should just remember, I told you, is keep on increasing, you're building your endurance, and you're not developing any like fatigue or those kind of symptoms.
Okay. What can I do to fight the side effects of prednisone that make me want to eat everything?
Every day. Oh, okay. I mean, I can tell you, you can discuss with the physician. It's always prednisone does kick up your appetite. When I was a resident fellow, my attending used to tell to the patients, and I think they listened to him. And he said, you try that. He said, eat celery, nothing on it, no peanut butter or anything. Eat celery. It's simple. It fills you up very quickly. You don't gain weight, and you don't get that kind of GERD or upset stomach type of. You can try that. I mean, that's what it is. It's unfortunate. This is a known side effect of steroid, and that is some reason people might be on the neurobiologic. But you should discuss with your neurologist also. What are your other options besides prednisone?
Thank you. One more question. Does B12 help with MG fatigue?
No, there's no evidence for that, which I mentioned before. If you're deficient, then you should take it, because that can cause a lot of side effects. I mean, a lot of symptoms, B12 deficiency. If you suspect you have vitamin deficiency, simple thing, talk to your physician. He or she should test the levels. If they're low, you should be treated appropriately, whichever vitamin is low. Most of us are low in vitamin D like David, because just stay inside. We don't get that much sun.
All right. Those are all the questions that I see. Are there any other questions that people wanted to ask? Dr. Hayat, thank you so much. This was really informative and a really good reminder of what we can be doing and what we can try to be doing.
Okay, thank you very much for joining. It was my pleasure being with all of you. Thank you.
All right, I don't see any more questions, so I think that's it. So thank you everybody for joining us. Don't forget, in the survey that you receive, we'll have our upcoming webinars. So we hope you'll join us again. All right. Thank you. Bye-bye.
Thank you.